Hello, my name is Gavin, and today I'll be doing an informative speech over the general responsibilities of a primary care provider, the relationship to their patients, and the impact of those relationships, and the differences between primary care and urgent care. So let's start off by just discussing what a primary care provider is and what they do. So a primary care provider is responsible for treating most baseline mental illnesses, such as, or health illnesses rather, such as cold, stomachache, or flu, just anything that's common. Um, they're also responsible for referring their patients to a specialist if need be, if it's something that the primary care provider cannot handle themselves. Um, in the article Choosing a Primary Care Provider, it sums up the roles of a primary care provider very nicely when it states, a primary care provider, or PCP, is your main source for general medical care. When you need a specialist such as a surgeon, urologist, or psychiatrist, your PCP may refer you to one. So, for example, when a patient comes in concerned that they might be afflicted by some sort of mental illness, the PCP would perform some preliminary tests to make sure that there's not any underlying health conditions, and then would refer them to the specialist if need be. Um, During my interview with Kendra Norris, she actually explained the roles of a PCP quite nicely when she stated that um, the role of a PCP is to act as a gatekeeper to their patient's overall health. So again, imagine a patient coming in to see their primary care provider. The primary care provider's role is to make sure that that patient is directed in the proper way to get their treatment done, the correct avenue to get that treatment done in the most effective manner. Um, it's the nature of the primary care provider job that allows for a strong relationship to be formed with the patient and the provider. Um, Mostly because the relationship between provider and patient can last many years, and it's a very reliant relationship on both sides. In the article, She Knows Me Best, the article discusses the findings of a study which got the opinions of people suffering from a chronic health condition, and it got the opinions of those people on their primary care providers. The article states, that patients and caregivers valued in-person follow-up with their primary care provider following discharge from hospital because of their trust established through pre-existing longitudinal relationships. So again, patients who suffering from chronic health conditions after their discharge from a hospital often want to see what their primary care provider says they should do, just because of the long-term relationship that they've formed with them and the trust that that relationship has instilled. However, primary care is not the only form of medicinal care that treats baseline health illnesses. Urgent care also does it, though it does it in a very different way. So primary care is typically more personally focused. It focuses on the whole picture. Urgent care focuses on that one illness or that one ailment that the patient is suffering from. Um, in the article, An Inconvenient Truth, Primary Care is Not Urgent Care, it discusses the differences between primary care and urgent care, and when it states fast food chains or the walk-in health centers for the appetite, they fill a niche for a society on the go, providing quick service at all hours for a fraction of the cost of traditional restaurants. The traditional restaurants here, of course, being primary care, and fast food chains being urgent care. These terms, I think, very well represent primary care and urgent care, because urgent care really is a kind of a quick fix, not something that you can really sit down and enjoy like a traditional restaurant or a primary care provider would provide. Um, Kendra Norris, who has worked in both urgent care and primary care, speaks on the differences between the two when she states, in primary care, you get to know your patients and form relationships with them, whereas in urgent care, you are dealing with mostly acute conditions. You treat the patient for the problem they are having that day, and you might not ever see them again. So urgent care and primary care are very different. Primary care providers have a very uniquely important job, especially in comparison with the other medical field, um, other professions in the medical field. Thank you for your time, and I hope this has provided you with some valuable information.